Good afternoon. Welcome to the third day, also the last day of HKDI Inspired Design for Wellbeing 2020 online master lecture series. This is now the third edition of HKDI Inspire Lecture Series. In the past 2 years, we focused on design thinking as a problem-solving tool or mindset applied to all walks of life. This year, we hope to delve deeper into the people-centric aspect of design thinking in enhancing human well-being in an ever-changing world, where new challenges keep popping up every day, such as the current global pandemic, which has expedited technological advancement and application, while AI, big data, IoT, etc., has become part of our daily life. How might we live better with these new technologies? Today, we are honored to have invited Professor ZHAO Chao, Deputy Dean of the Academy of Art and Design, founder and director of Healthcare Design Innovation Lab of Tsinghua University, and Mr. Clube NG, CEO of eHealth Research Institute, as our speakers. The lectures will be followed by a sharing by Mr. Keith Sam, Head of Communication Design of HKDI, who would also moderate a panel discussion with Professor Zhao, Mr. Ng, and our special guest, Dr. Tony Chen, specialist in general surgery. You are more than welcome to leave your questions for our speakers at the Q&A session of Zoom video webinar. I'll post them on the live broadcast of HKDI Facebook page. Without further ado, I shall pass the virtual stage to Professor ZHAO Chao for his keynote, Designing in the Post-COVID World.
Good afternoon, everybody. Thanks for the invitation to give me such kind of opportunity to introduce the design research and the design practice in Tsinghua University. So the topic of my presentation is designing in the post-COVID world, co-innovation between art and science. As we know that, with the change of the social cultural context from the industry age to the post-industry age, the design paradigm transfers from the technology and product innovation to the business and the service innovation. However, this pandemic changed the world already. The question is how COVID-19 might change the design in the future. I thought that design will transfer from the commercial-oriented value to the human and society-centered paradigm to rebuild the new order of the global connection, collaboration, and innovation. So, artifact trajectory will transfer from the functional product to the meaningful system and the social impact with the sustainable way. Designers have to implode the social innovation paradigm to develop a product, service, interface, project, multi-user system for the social inclusive growth. Nigel Cross defined design as an interdisciplinary discipline. Design is to connect all branches of the disciplines, reach a consensus, create new knowledge to re-understand designing. Design is complexity management as well. According to Donald Norman, complexity is reality of the world. Technology must be complex to match the activities in daily life. Complexity is not only inevitable, but also a new starting point of design and a new opportunity to solve the problems. A good designer must learn to manage complexity, and management itself should become an integral part of the contemporary design. In 1970s, Victor Papanek published the book named as Design for the Real World. This book calls designers to develop solutions to meet social needs like designing for aging population, disabled people, disaster, and the healthcare system. Nowadays, design is everywhere in the world. In China, there are around 1,000 design creative industry parks around nationwide, 10,000 design companies, 100,000 design institutes, 1,000 design centers, 1,000 design institutes, 1,000 design centers, 1,000 design companies, 1,000 design institutes, 1,000 design companies, 1,000 design centers, 1,000 design companies, 1,000 design institutes, 1,000 design companies, 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 1, 500,000 professional designers are working in the industries. We have 33% annual growth rate of the patent application. Moreover, there are around 2,000 design schools in China with 1 million students studying art and design in the universities. It's no doubt that China has the largest value of the design industries and education in the world. There are few factors impact the development of design in China, such as commercial society, continuous urbanization, mix of industry society and post-industrial society. Information technology impacts the lifestyle and healthcare and well-being system. Since 2019, the needs for the healthcare and well-being service system become a significant factor to influence the future design paradigm. As a professor in Tsinghua University, I like to explore the future of the design education and practice in the post-COVID China by introducing the development of Tsinghua design disciplines here. Like many universities around the world, Tsinghua is quite big and multidisciplinary comprehensive university. It consists of 20 schools and 58 departments with faculties in science, engineering, humanities, law, medicine, economics, management, of course, the art and design, etc. Totaling 14,000 staff members and 47,000 students studying the campus. Academy of Art and Design in Tsinghua University is established in 1956. It's the earliest design school in China. There are 10 departments in the school, which include the ceramic design department, fashion design, industrial design, environmental design, visual communication, painting, sculpture, etc. According to the Chinese Education Ministry, we are the top 1 design school in China. According to the QS University ranking, our art and design discipline is ranking as number 18 in the world. Under the umbrella of the Academy of Art and Design, we developed 2 important platforms to support design education and research. One is Tsinghua Milan Design School, located in Milano. This school is collaborated between Tsinghua University and Polytech Milano, based on the National Cooperation Agreement, which is supported by both Chinese and Italian presidents. By integrating the education resources in the world, this platform will provide students with the global vision, interdisciplinary and intercultural learning, and cultivate innovative knowledge and global leadership. Another new important platform I'd like to introduce the details today is Art and Science Innovation Research Institute, which focuses on design research and application of research outcomes. This slide shows the campus of the institute, which include a museum, research studios, laboratories, incubator hubs, etc., totaling 14 buildings with the different functions in the campus. The institute is committed to 4 areas of research, which include product design for the information age, environmental design for the urban and rural development, social design aimed at the healthy and inclusive growth, and art and design based on cultural heritage transformation. Through linking and collaborating with the local and international industries, the Research Institute is going to building a world-class research and development, incubation and service in the design innovation domain. Today, we understand that design is a complex activity to develop innovative product and service through integrating the education, research, and practice. I think there are many relationships between the research and the design, like research through design, designers research, research on design, research in design, research for design, research reflected design, etc. So, why our design research platform is named as Art and Science Innovation Institute? According to the Bruce Archer, design is a third discipline different from the science and arts. Science is discovering the nature with methods like experiment, induction, analysis. On the other hand, art is studying the human experience with methods like an analogy, metaphor, evaluation. However, design is creating the artifact through integrating the knowledge generated by the science and arts and constructing the man-made world. So, the Institute is committed to the generation of the new knowledge, the cultivation of the innovation leading talent, the response to the challenge of the global change, and the promotion of the sustainable and healthy development of the society. Through the integration of the art and science, the Institute is going to promote the collaboration innovation of the culture and the technology, university and industries, talent cultivation and social needs, enterprise and industries, Tsinghua's disciplinary advantages and the local economy, etc. In the Research Institute, we are developing 6 research platforms, which include the Future Transportation Innovation Center, Future Living Innovation Center, Future Fashion Design Center, Future Healthcare and Wellbeing Innovation Center, Future Learning Research Center, and Cultural Sustainable Development Research Center, etc. The Institute is focused on the transfer the research outcome to the commercial and incubating new companies and industries to leading the future innovation paradigm. We conducted research and practice in the 5 areas, which include design thinking training for the entrepreneurs, design consulting to the transfer new technology to the market, developing methodology and toolkit for the design innovation, conceptual design for the future industry upgrading, and design intellectual property trade and transaction. I'd like to give you some examples to show what we did in the Institute for the Future Wellbeing. Healthcare Design Innovation Lab is a multidisciplinary design innovation platform we developed, which integrates designers, engineers, scientists, and doctors to develop a product, service, environment for the human-centered healthcare system and well-being innovation. The lab investigated the effective system-based design solutions to current and future healthcare challenges. We employed methodology and tools like inclusive design, co-design, design strategy, service design, and so on in different projects. We mapping the interaction among the different stakeholders like hospital, doctor, patient, insurance, service, etc. to explore the social inclusive and human-centered design solution for the healthcare and well-being system. To face today's pandemic crisis, we developed a new microfluidic biochip system for rapid detection of COVID-19 virus within a couple of weeks. It's a very quick design process. This system can detect 19 types of respiratory virus, including COVID-19, within 1.5 hours. It's a first medical instrument to detect and diagnose the COVID-19 in Wuhan. The system provides a human-centered design solutions for rapid and efficient response to public health crises with the modular design, high throughput, intelligence, and easy to assemblies, as well as a user-friendly experience. As you can see, the pictures shows the application of this system in Wuhan Huoshenshan Hospital. In the post-COVID era, is it possible for the people monitor health condition themselves and detect the COVID virus in the home? We integrate the easy-to-use mode like the pregnancy test sticks and funny experience like playing game machine together to develop a household rapid COVID test toolkit for the family. People can easily test themselves within 20 minutes at home with the user-friendly experience. Just like using pregnancy test sticks and playing game machine. We are developing a COVID-19 mobile laboratory, and it will be launched into the market in the next month to quickly respond to nucleic acid detection in different regions in China, with safety, reflexibility, efficiency, and mobility design solutions. Now, through employing the cutting-edge technology like AI and biochip, we are integrating the modern Western medicine and the traditional Chinese medicine together to develop a public health crisis detection AI network to predict the potential healthcare crisis. Moreover, to promote the Sustainable Development Goals, we are exploring the opportunity to work with the United Nations Social Compact and the iPhone Media Group to establish a social design research lab. And we are going to work with the HKDI to establish an International Design Education Lab. The laboratory aims to foster interaction between international design schools with the Chinese colleagues for their mutual benefit. The lab is going to develop international design curriculum standards to promote the quality of the design education. This will help design institutes with cultural difference to balance design research and practice, and to cultivate the design talents with the global leadership. The curriculum comprises 3 key elements. The first one is cultural transformation design innovation, which might train students to do the material-driven design, cultural heritage design transformation, and so on. The second one is social design, which might introduce the methodology and the tools for the area of the healthcare design, sustainable design, design for aging population, etc. The third one is design for manufacture. Students will go to the industries to better understand the manufacture and design in China, and work with the in-house designers of the local industries to develop a product and a service. One of the important programs we developed is Global Innovation Design. I'm the co-founder and chair of the professor for the Global Innovation Design program we call the GID program. which is a master program collaborating with the Royal College of Art, Imperial College, and Tsinghua University. This is new type of the multicultural and multidisciplinary design education to develop creative leaders through the broad experience and understanding in design. GID partners are working together to develop the curriculum and share value in different cultural contexts. We bring the students from the different cultural background to work in the local companies and communities and get the insight and inspiration from the Chinese culture, society, and industries. What I believe is there are 10 types of the design innovation for the future post-COVID world. Designing for profit mode, network, structure, and process build the business model-centric innovation. Designing for product performance and product system build a platform-centric innovation. Design for service, channel, branding, and customer engagement build experiment-centric innovation. I have to say, successful design innovation has to balance 5 or more types of innovation, and most importantly, all 3 colors are involved. So, what will happen in the future of the post-COVID world? I think it needs designers' contribution. Thank you.
Thank you, Professor Chao. May we now invite Mr. Clube Ng for his lecture, A Trustworthy, Intelligent Health and Wellbeing with Design Thinking and Collaborative Action.
Testing. Good afternoon, everybody. Thank you for the HKDI to invite me to have some sharing in this afternoon. So today I will share some thoughts and experience about the eHealth, or I say it as a health intelligence for this topic, trustworthy, intelligent health and well-being with design thinking and collaborative actions. Okay. First of all, I will introduce a little bit myself. I have over 20 years in the technology, major in the eHealth sectors, and in these few years, I involved in city innovation sectors. So my organization is eHealth Research. Most is a social enterprise, also focus on the research, health innovation, and focusing on some pilot and trial project using IoT and some edge technology. Another NGOs are involved, including 2 NGOs. One is eHealth. Asia eHealth Information Network is a WHO-supported NGOs. The chairman is from the directors of the MOH, Ministry of Health in Malaysia, also some professors from Thailand and from Philippines. And so they have over 800 Asia members. Most is from the professors and also some officials of different countries. And the second one is CIH. CIH is a NGO founded by me and my friends in Europe as a professors in Finland, Sweden, and also some European countries to facilitate the sharing and collaboration of some city innovation technologies. Okay, so today I would like to share some experience about this topic. First, I will talk about what is the innovation and intelligence. Then I will introduce about the health system and the eHealth development in Hong Kong. And also talk about some challenges, the eHealth or digital health, how to adopt those technology in Hong Kong. And I will like to propose a new approach about in contrast of the traditional health approach. And those approaches will including some interdisciplinary and co-design approach. And also I will share some cases can transform to this approach. Okay, first of all, as a professor, the previous speaker sharing about that, as an innovation, when we talk about innovation, we always talk about how to discover, to reshape, and also to create a new model to disrupt the existing pattern. So for innovation, we always want to bring the intelligence from the innovations. And especially in these 10 years, we are all living in the digital world. So when we talk about the innovation and intelligence, we need to use the digital data-driven technology. So we will say that we will use the technological innovations. And when we talk about the technological innovations, we will always hear some terms like IoT. I think all of you have heard some IoT or AI. IoT is like Internet of Things, big data, AI, artificial intelligence, blockchain. Blockchain is a decentralized ledger, and also edge computing and robotics. This diagram will introduce a little bit about how the IoT and AI to link to different applications in our world. For example, when we talk about the healthcare, as you use an Apple Watch or use wearables, this means that we will connect data from the wearables to the cloud and then to the machines. We say it IoT. And IoT is only one way to collect the data, personal health data from each individuals. And then we centralize to the cloud, and the data will bring to the back end to facilitate the machine learning or to mature the algorithms of the AI. So in our world, AI already applied to different applications like building management, like the device, retail, healthcare, logistics, machinery. In the right diagram is all about how the IoT, AI, those technology apply from the base level, like the 5G, Wi-Fi, Bluetooth, NFC, and also some new technology for the different communications. And then to the top, we can spread to the different smart applications. In these few years, I think most of you have heard about the smart city. This planning actually is Hong Kong government fund the ITB, Innovation and Technology Bureau, in 2016. So this concept also the main focus of the IT development in Hong Kong, and it focused on the urban development from a professor, a academic Boy Cohen in six areas like smart environment, smart living, smart economy, smart governance, smart people. So those areas in these few years, not only in Hong Kong, but also in other cities, they focus major in the civil and technical infrastructure. And the implementation of this smart city most likely is they will formulate policy and then use a management and control approach to deploy those policies to the society. However, today I would like to share another angle for apart from the smart city. I would say it's a city innovation. So we will put the design and the humanity in the center in the city development vision. So all the design of the city innovation is citizen-centric. Citizens and all the experts from different sectors will co-design the city. And we will cultivate the intelligence to better the city development. So our focus is to inspire, to explore, to collaborate, and then to make the evolution. Here are some examples of the smart city. Actually, these are examples already for 4 to 5 years already. In US San Francisco, they already launched the crime map. In New York, they will turn the phone booth. In Hong Kong, also there are many phone booths, but in New York, they will turn the phone booth to the Wi-Fi station. So citizens in New York can connect to the Wi-Fi also to charge their mobile phone in the Wi-Fi station. So in Minneapolis, they will have a platform to find the shoulder device. In Singapore, smart parking, smart planning. In Barcelona, the bus stop not only show the time arrival time, but they can also connect to the Wi-Fi and also can charge the mobile phone. So back to Hong Kong. I don't know if you have know that in Hong Kong, Octopus already over 20 years, the technology. Then the Hong Kong government launched the digital 21 strategy, the policy. And also in the past 5 to 10 years, I think, if different CE of Hong Kong, they will have launched some policy like Sabaport, Science Park, Kowloon East. Kowloon East is adjusted as a new CBD, Central Business District 2, like Central. And then the loop means that the Lok Ma Chau near the Shenzhen. Lok Ma Chau is a Shenzhen, Hong Kong, the Science Park. And then the delivery is a Wi-Fi hotspot, 5G smart ID, also eHealth program. But you can see that those delivery most likely is a quite technical infrastructure instead of quite little disruptive design inside those things. So back to this today's topic about the health system. We can look back to our Hong Kong health system. This year, our population 7.5 million, over 2 million, already over 60 years old. And 10 years later, 2.7 million. So you can see that Hong Kong increasingly become an aging society. And in existing, our major focus on health is a sickness, diagnosis, treatment approach. And Hong Kong also adopt twin system. For the inpatient, over 90% of the inpatient service provided by government, 42 public hospitals. Only 10% from the private market of 12 private hospitals. For the outpatient, like some GP, specialty, surgery, over 70% from the private sector and 30% from the public. In Hong Kong, planned the 200 billions for the 10 years hospital to build more new hospital and then to provide more beds and the rooms. However, there are some challenges for the existing health system. You can see this diagram. You can see that for most hospitals, the capacity over 100%. It's not new. You can read it from the newspaper every month, over 100%. And also for this health expenditure, you can see that the most expenditure for the inpatient curative care. And you can see the middle one, the home care, the rehab, the long-term care, and the prevention, the resource, very, very small part. The right side, you can see that there's a long-term care, the disease increase rapidly. So in 2008, Hong Kong government launched a health reform consultation. And then they will rely on that technology, digital health can partially solve this problem. So in Hong Kong, we can go back to the 30 years ago, 1990. There's a Hong Kong, the hospital authority established. Then HA, the CMS, the clinical management system to start the development. And then after that, 2003, SARS hit Hong Kong. 2006, there are some PPI, there's an eHealth record provided to some GP for sure the eHealth record. And 2008, healthcare reform consultation and validation of the eHealth record. 2016, the first eHealth law launched in Hong Kong. And then in these few years, the eHealth program of the eHealth record service system launched. This is the eHealth record service system. I think some of you already joined this program, and then you can share your eHealth record to between the public and private sectors. they will adopt 3 keys sharing consent model. It means that this program need to get your consent, and also the doctor need to join this program and then get your personal consent. This slide shows that there are 9 scopes of the shareable data for the health record. You can see this data in the website of the Hong Kong government. This is the software. This software is developed by the HA Hospital Authority, free of charge to the doctors. But the license is free, but the installation and the maintenance provided by the private sectors. And this slide will show that there are 3 areas for the digital health adoption. First one is IoT. As I said that the like health wearables, Apple Watch, and sensors. Second one is big data. What is big data? Big data is that there are some unstructured data, like our wearables, social media, sensor device. The format is very different in each device. It's apart from the standardized eHealth record from the HA health system or some clinical systems. So the problem is that how to interoperable between those unstructured big data and the standardized eHealth record. And the third part is health AI. So IBM versions. IBM traditionally, they will provide a computer, of course, the server, but their version is quite famous in the health AI. They will use the AI to predict some cancer. They will scan the X-ray image to do some algorithm and then to calculate the percentage of which slide the patient have the possibility of get the cancer. Also Google Fit and Apple Health. At the bottom part is a many health eHealth vendors. Of course, besides that, for the eHealth, we have some like eHealth stations, smart mirror, HA apps, booking apps, robotics, surgical robotics, some system for immunization, elderly health, and also pharmacy. And as the previous speaker said that for the COVID-19, actually in this year in China, the health code already launched to detect who to be quarantined and also to make some social activity restriction. In Hong Kong, I think the Hong Kong government will launch the tracing app soon, I think this month. And also in Europe, there are some also some COVID-19 eHealth solutions, like the e-learning portal and also some e-news. But how about the challenge for the digital health adoption? I think that there are several challenges. The first one is that traditionally, it adopts the diagnosis treatment hospital-centric. The data is not interoperable. For the GP, the private clinics, only can read the data, but you cannot use the data. Read and use and operable is different concept. For example, the data can only show on the screen, but for the GP, for doctor, their system cannot use and get out the data to use in another systems. And also, there are some trust and privacy issue. In most applications, they use the AI from the image. However, the image have some privacy issue in many cities, like in San Francisco and Boston. So face recognition already banned in those cities. In Hong Kong, last year, the Hong Kong government launched the multi-purpose smart lamppost in Kowloon East, Kwun Tong. You can see that some camera originally is installed in the lamppost, but there are some privacy issues from the society. So they already removed those cameras. And this year, some smart lampposts, they use the LiDAR, LiDAR. LiDAR is another technology, not use the image. They use the some light wave to detect the shape of the human instead of the face. So it can greatly to protect our privacy. So we can see that those technology, especially in health, we need to concern about how to make it more trustworthy and intelligent, and also how those data can provide more valuable and actionable insights for our personal health. So this sharing, I would like to propose a new angle about the trustworthy intelligent health and well-being. You can see this table. The left side, this one is 2008, the health consultation cover. Your health, your life. So trustworthy intelligent health, I will focus on the citizen participate. We do not only act as a user, we can all act as a co-designer. It means that for the apps, for example, if some health app provide to you, you can customize the app, the first level, the app interface by yourself. And also you can control, manage your own data behind the app. It means that in the current practice, most apps provide to you the health data. You cannot delete the data from their system. But in Europe, they already have some GDPR, the law. It enforces the vendors to provide the functions for the user to delete their health data from the system. But in Hong Kong, in mainland China, in Asia, this application not enforced right now. The third one is about citizens, how to collaborate with doctors to co-manage their health. What is co-manage means that because in Hong Kong, the health record, the law does not define the ownership of your data. It means that your health record by law, you do not have the ownership. The Hong Kong law do not define the clear ownership of the health record. So I think that if we adopt the trustworthy intelligent health by the law aspect, we need to propose to clearly define the ownership of the health data. So the last one is that the benefit of this angle is that when we define clearly about the ownership of health data and protect the citizen management right to manage their data, so more citizens is willing to crowd sourcing or crowd providing their data to the platform because they are the co-designer. So the cost of the cloud input and is very low and become easy to compile a collective intelligence for better personal health management. Okay, this slide is the existing, the upper side, WHO, their methodology from input, output, outcomes to impact. Traditional, they will count the finance, workforce, governance infrastructure as input. The output is surface access. The outcome is intervention coverage. And the impact is the responsiveness, for example. But in the new approach, we can see that in this digital world, health data, big data, are the important input, and also the collective intelligence. The output is the actionable insights from the health data. And the outcomes is our collaborative interventions. Because doctors and nurses is not only the healthcare team, ourselves, personal health, we can also involve. For example, if at a home, some elder home, if there's no doctor and nurse, how about the healthcare worker to handle some emergency case? So the collaborative interventions is very important. The lastly is a little real-time interactions. Because in the traditional model, we need a longer time to interact with the emergency case. But for this well, we can have more data to more quickly respond. This slide is another from the WHO. So you can see the right side that we can use the population-based real-time data to contribute and respond. And this slide, we can see that citizen can be the healthcare planner, healthcare reviewer, and also we can support them with the health data. Okay, this slide, traditional, this model, the red one, we can use the human-machine interoperable model. It means that for the AI is presented in the robotics. It means that if we use a health robotic, behind the robotic is AI. But how about the human and the robotic to collaborate? So this is the trend and the challenge in the future. So to ease this challenge, the trustworthy principles is very important. This slide, I will propose 3 principles. these three principles already adopted in the AI in European Union, EU. So EU, they have the Trustworthy AI group to promoting these principles. The first one is respect for citizen autonomy. So for some AI or some robotic, many people already concerned about can an individual or citizen to oversee or control. For example, we are now talking the autonomous car. If the car running in the street, do the driver control or the machine control? This is always the question. So I will propose that we lead the citizen to have the right to oversight and control. The second one and the third one is about the design principle of those technology. In the current trend, there are two principles, design principles. The first one is zero knowledge principle. It means that those AI or machine learning, they will not keep most of your data. Indeed, the data will keep as a federated learning in the local device. So your most sensitive data will keep in your own device, and only some minor data and non-identified data will contribute to the cloud and to the AI for their machine learning. So this is P2P or federated learning. Another angle or another principle is about the contextual integrity design principle, like the GDPR. It means that the user, although they will contribute their eHealth record to the cloud, but they have the right to manage and control their data. So GDPR is one of the examples for these principles. The second principle is about diversity and fairness. When we design the AI application or the sub-intelligent application, the first part is about the big data. But in these few years, there are many issues about some biased data input to the AI. So the outcome is quite biased, the decision. So the principle of the non-discrimination, transparent is very important. But if you know about a little bit about AI, deep learning is quite common now for the AI design. So we need some fairness principle to track into the some deep learning design. For example, we use the pre-processing training set. It means that the data set input to the AI, you lead to the pre-processing. And also we need add a regularizer to the AI model. The third principle is about the prevention of the harm. So we need more cybersecurity, the regulations, and also health data to data end-to-end checking. And the last one is health data audit. You know that for many systems in the cloud or health application, the health data have not been audited. So if in the future we promote more blockchain technology, the health data cannot be deleted or changed. So the health data can be audited. So besides the trustworthy principle, we also need the interdisciplinary and co-design approach. I will quote one example. In a few years ago, some experts co-designed a new innovation called optogenetics. Optogenetics is a new innovation to control the brain circuits with light. So this innovation is co-designed by experts in molecular biology, genetic engineering, surgery, fiber optics, and lasers. So you can see that not only medical experts, but also some physical experts, some engineering experts co-designed this innovation. And this innovation also won the prize from the Royal Netherlands. So the interdisciplinary and also co-design participation is very important in this approach of the trustworthy intelligent health. So we can piece by piece of correct idea to modify the systems to better the big ecosystems. So I will introduce some examples. The first one is a drug and health intelligent caring application. This application is this year I am working with the IFI, another team is with some pharmacy and also some computer college students. This application will adopt some collective intelligence for trust and health insights and advice. It means that for the trust information, we will do not only apply the knowledge base from Hong Kong, we will use also from the general information from the Dropbox, some manuals, and also from several countries' database to combine to the application. And then we will build a AI model and also hybrid with the human advice. It means that we will put some pharmacy advice into application to provide a hybrid advice to the users. And also the data collected will contribute to the health medicine ecosystem to enhance the overall the algorithms. The second one is the real-time monitoring. The upper side is the current practice that when the IoT sensors, they will be used to monitor the patient on the bed and then to upload the data as some algorithm and then to send some alert for the healthcare staff. But the new approach is that already some hospital or some clinic already use that, is to use some personal health monitoring. So the patient, after going back to home, we will continue keep the monitoring and then we'll combine with the eHealth record and some big data and AI intelligence. So the overall application can provide more hybrid consultation, diagnosis, and acceptable insights. This one is another application I and my partner involved. It's about use the retina image behind the eyeball to compare with some image to predict whether the risk of the diabetes. This one, smart home. I think that this is not quite new because in these few years, many home already adopted technology, use some behavior sensors, telehealth portal to monitor the living habit of the users. This is useful especially for the elderly. When the single elderly, they will have some fall detection. So some users already use to detect the fall detection. This one is in Singapore. Do you know that in Singapore public house, they will have some monitoring each floor. When the elderly, if they have low some outgoing for a few days, some will have some alert in the floor, the monitor, to let the guard to see if some caring to the elderly. So those data can be collected to be a big data to enhance, to analyze the behavior of elderly in Singapore. Okay, so these few cases is I just to mention this in this speech, and I hope that lastly, I hope we can work together to have some collaborative actions to co-design, co-create more innovation, because you know that only one or two persons cannot do many things. So we hope we work together to make Hong Kong health great again with intelligence, integrity, and courage. Thank you very much.
Thank you, Clube. May we now have Keith for sharing design thinking in teaching and learning.
Hi, everyone. I'm Keith. I'm Keith Tam. And slightly different. This presentation is a short sharing, around 15 minutes, on what we've been doing at HKDI on the teaching and learning of design thinking. So if you were here for the past 2 days, you would have heard some of the projects that we've been doing and some of the initiatives on design thinking. We have a design thinking team that takes care of 4 things: academic development, international knowledge exchange, projects, and also professional development. So today, I'm going to talk more about the teaching and learning side of design thinking. So I think this is a very common conception of what design is to a lot of people, especially the general public. I've asked a 6-year-old girl in our family to tell us what design is, and she said, oh, it's to make things nicer. So this is quite ingrained in our mind of a product-oriented or an artifact or object-oriented way of looking at design. Perhaps as styling, as drawing, or as visual pursuits rather than other things. And I have 2 quotes here. One from John Heskett: "Design is to design a design to produce a design." So it shows how confusing the word design can be, and how it can have many different meanings. And Paul Rand said something similar, saying that design is both a verb and a noun. And I think the way we look at design needs to be focused a lot more about design as a verb rather than design as a noun, I think, in a way. And then Professor ZHAO actually said something similar. Nigel Cross mentioned that there are the sciences which focuses on objectivity, rationality, neutrality, and a concern for truth, kind of like a pursuit of truth. And humanities or the arts, which is more about subjectivity, imagination, commitment, and is a concern for justice. And design is somewhere in between. Design is a third culture, as Nigel Cross says, which is focused on practicality, ingenuity, empathy, and a concern for appropriateness. So design is to not to find the truth or anything like that, but to actually satisfy a need that needs to be addressed. And one thing that we really emphasize a lot in the way that we teach design is to not look at design as a series of steps or as a procedure. So it's very easy to kind of fall into this trap of thinking that design is formulaic and can be followed in a step-by-step kind of way. It's not a cookbook. There's no recipe. So this is very important when we teach and learn design. And it's also very challenging because students or clients look for a procedural way of solving a problem, but design really isn't about that. So in a traditional way of looking at the design process, designers usually come in at the end of a process, having done everything else, for example, research, a business plan, looking at technology, operations, all of these things, strategies, and then design come in at the end as a way to make things look good. Don't get me wrong, it's important because we need to differentiate our product or service from others. So, that actually has a role as well. But I think a different way of thinking about the design process should be design from the very beginning, not only the visible part of what we create. So design actually has a role in research, has a role in business and technology, etc. So this kind of a parallel approach of looking at design is very relevant for a complex world, so to speak. So what we emphasize is design is not a linear process. It doesn't give you a single correct answer. It's not science. Science might give you a single correct answer. There are many possible answers, and there are many possible ways of approaching a problem. So how do we decide on the most suitable and appropriate one? So it's not a formula that can tell you or calculate what the correct answer is. So another challenge in the learning and teaching of design thinking is how at the beginning of a design problem, at the beginning of a design project, things can be very, very foggy and ambiguous and uncertain. This is something that students find very confounding or very unsafe, or even teachers, because teachers are kind of expected to have the answer, but in fact we don't when we start a project. So the idea of embracing this fogginess or ambiguity is very important, acknowledging that it is there and it's normal to be there. So one thing that we've put in the toolkit is shift happens. I hope you heard it right, shifting. Because you have to be able to shift to different ways of doing things and activities and perspectives and scale as appropriate when you're going through a design process. So in an art school kind of ethos, when we're looking at design, we're looking at the designer as a creator, which is more inwardly focused to develop ourselves. You know, the idea of kind of cultivating a sense of aesthetics, for example, which is very inward focused. But you know, in fact, designers can now be enablers. Designers can use the skills to enable things to happen for other people. So we increasingly need to shift our focus outwardly to other people. So a collaborative, not this one. Okay, all right. So designer as an enabler. So when we're talking about designing systems, services, we are talking about designer as an enabler. We're designing tools and things that help people in a systemic way. So we need to shift from product thinking, you know, looking at things in isolation, objects, products, devices, interfaces, information, communication, spaces, environments, into people thinking, product thinking to people thinking, experiences and systems. So looking at connectivity, things that are in between, actually, experiences, communities, services, relationships, systems, processes. So that's a very important way of shifting perspective of what a designer does. So when we look at 21st century skills as proposed by the World Economic Forum, the top 3 of the top 10 skills, complex problem solving, critical thinking, and creativity, are the core ingredients of what design thinking is, really. So in order to deal with an unpredictable world, we need to have these skills that kind of balances the left and the right side of the brain, so to speak. So in our experiences of teaching and learning design thinking, we kind of identified that a lot of time is spent on executing a design project, on making things. There's nothing wrong with that, but if we don't spend enough time to do research and to do testing and evaluation, the efforts would be wasted. So I think this is a bit extreme, of course, but kind of shifting this triangle is important because we might not be solving the right issue or the right problem. So at HKDI, we've implemented quite a few modules, we've been implementing design thinking at different levels. The core module, the creative and design thinking, is a module for everybody at the Institute. So over 2,000 students go through this module every year. Well, we've relaunched this module last year to really strengthen the way students handle design projects. And we also have a design thinking enrichment module for other for students from other disciplines that they can choose to do, so which is more broadly relevant in terms of design, adopting design thinking in their work. And project-based learning is something that we've been pushing throughout VTC as we speak. And of course, in terms of design education, project-based learning has always been an important part of what we do. So using lifelike or real-life briefs and situations and adopting design thinking in a project-based situation is also what we're pushing for. So we need to think about students being job ready, right? We need to develop their competencies to land the first job. That's very important. We're a vocational education institution, but perhaps in a bigger way, we need to harness transferable skills to think of students who are future ready. So transferable skills that can build the resilience in an unpredictable world. This is becoming increasingly relevant and important for everybody. So we've developed a design thinking toolkit to help our teachers and our students to learn design thinking and to teach design thinking. So it's a kit with 9 worksheets for facilitating collaborative work in project-based learning. We have a workbook for students that put mindset into practice, and we have a model called E5 Actions, which I'll talk about. So this is the workbook. And we have a stack of inspiration cards. So this is not a game, a card game, but it's a tool that helps designers to shift perspectives when they're stuck, to find ways to get unstuck. So as I mentioned before, it's not a procedure. So this becomes an important tool. So some examples. So on one side, you have chat with a stranger, start a conversation with someone you don't know. And then really it's a method. It's an open-ended interview. And a bit of advice, don't be a perfectionist, because designers tend to focus on the small details. They like doing that. But the real the real issue here is identifying things that are taking up too much time and refocusing yourself. So we have ideas like that. So E5 actions, we don't call it a process or steps or things like that. So there are no apparent order to these 5 E's. It's basically a mnemonic for students to jot their memories of the kinds of activities that they can do. So it's not a linear process, so these can be used in different combinations. Engage, it's a very simple word, is to get people involved, basically conversations, understanding. So it's a divergent process. If you're familiar with the double diamond model, you're kind of expanding options and possibilities to keep your mind open. And envisioning has to do with coming up with ideas, so it can be divergent, expanding horizons. It could also be convergent when you're, for example, writing a problem statement is also a part of envisioning. And evaluating is to gather feedback, to evaluate your options. So after your engage activities, you can evaluate and consolidate your findings. Or if you've created a lot of options, visual ideas, you can evaluate and kind of narrow down and choose the most appropriate to develop. So that's a convergent process. And to experiment, it's also to prototype, to kind of get your hands dirty, so to speak, to draw, and it's a divergent process. And enabling, probably if there's any order to these 5 E's, enabling would be the last one, to get down to business, to make things happen, to get things off the ground. So we have a rocket there to get things off the ground. So it's a convergent process. Selling your idea is also very important. So we really emphasize on making thinking visible. So you can think like this guy, but you can also get everything you've been thinking in your head to be on paper and share with others, to collaborate with others. So making the thinking visible is very important. In traditional design education, where people think, oh, I'm stuck, I have no inspiration. But have you done anything? No, it's all in my head, right? So being able to make things visible, you might not be someone who enjoys drawing or draw very well. It doesn't matter. It's a way for you to share what you're thinking with others and to build on what others have been doing as well. So, we make artifacts For example, this is an experience map. We draw together on a big sheet of paper with a thick pen so everybody can see. And we make prototypes. It doesn't matter if it looks really, bad, or we just taping things together. That's important because you can make ideas tangible and testable, more importantly. So sharing, this is enabling, I guess, presenting your ideas to the group for feedback. It's also very important. So a fun atmosphere, highly participatory, those are really key kind of ways to infuse a sense of design thinking into your class. So lately, we've been having online classes, and it happens online now. So we have a pitching poster on Jamboard with a lot of students participating and commenting on other people's work. So this has proven to be quite an effective way actually to engage with students. The level of participation actually is higher, I heard, than when the students were in the same classroom, for example, because everybody can see can see what everybody else is doing clearly. So that's basically it. I think that's probably more than 15 minutes, but hopefully you get a bit of a sense of what teaching design thinking is like at HKDI. Thank you.
Keith, please remain on stage. May we now invite Dr. Chen and Clube for the panel discussion, and let's also get connected with Professor Zhao.
Hi, Professor Zhao.
Hello.
Hi.
Everybody. Hi. Good to see you.
Yeah, well,
Oh, no mask.
no mask. Right. Well, you're probably in your own room, so it's okay. Well, I guess you don't need masks anymore, right? Over there.
Yeah, I think everything is better now.
That's great. Yeah.
Oh,
wonderful. Yeah. Well, we've heard a lot of ideas. I've written down a lot of notes. Let me try to get my iPad open.
Yeah.
No face recognition.
Mask recognition.
Yeah, we need that actually. So, Professor Zhao gave us a very comprehensive overview of what design is happening at Tsinghua, especially in a post-COVID-19 kind of world with some very kind of grounded work on the coronavirus itself, and also how the teaching philosophy and the research directions at Tsinghua. So that's very interesting. And Clube talked about a lot about technology and innovation in terms of applied to healthcare. And then we have a physician here as well today with Dr. Chen. So I think it's going to be a good conversation, I think, if I may say so. I think maybe we'll start with culture. Maybe we'll start with culture. When we talk about health and medical issues, it seems to be a very scientific thing and, very kind of rational kind of thing. But how about when it comes to culture, between Asian cultures, Asian and Western cultures? Are there any differences or similarities in terms of attitudes about using technology in health? Maybe we'll start with Professor Zhao, maybe?
All right, so I think from the education perspective, design education perspective, so what we did in last couple of years is develop a new program, as I mentioned before, we called it the Global Innovation Design. So this kind of program just explored the how cultural diversity can contribute something for the design society, also can contribute something for the our community. And I talk about the three areas for the curriculum. The first one is cultural transformation. Second one is social design for social innovation. The third one is design for the industries or manufacturers.
Right.
I think so. This kind of program, we developed some kind of modules, which means the students who come from the different cultural background in Royal College of Arts and in Tsinghua University, we exchange students together, which means the RCA student has been sent to Tsinghua University to study in the Tsinghua campus for 1 term. And also we send Tsinghua students to the London as well. So I think that it's good for the student from the different cultural background to get the deep insight for the globalization and localization, and then develop the different design solutions for the global market, especially from the social design, social design perspective. So I think that's some kind of exploration from the Tsinghua side. So what I would like to know is, I think maybe the design school in Hong Kong might develop the more interesting program, because the Hong Kong, the location of Hong Kong is quite special, and it can be linked the Eastern culture and the Western culture. Maybe it's a very good bridge to experiment.
Do you find the students on both sides, their assumptions being challenged or preconceived ideas frequently when you have collaborative projects like that with the UK, let's say?
So what do you mean, the student from the
things that they find very familiar, but all of a sudden they find that, oh, it's not like that, kind of.
I think it's good for the student to work together, because most of project student did is kind of we call the multidisciplinary teamwork. So I think that it's good for them to balance the different ideas and different cultural insight. And it's quite interesting that we often send the student to the Western student to the rural countries to do the field study, to live with the farmers for certain days. It's good for them to get the deep insight and to develop the.
So I think for the culture difference in the healthcare or healthcare delivery, I think that for Hong Kong or for mainland China, most people will also listen to the doctors' the advice. But I think that for the Western, maybe the patients maybe more will challenge or ask why we use this medicine. They have more will go to Google to search their own knowledge and then to give some advice to the doctor. I think it's quite different. So I maybe Dr. Chen have more experience about that. I don't know in Hong Kong, but I experienced that. So, but I think this is good because as you say that there are many methods for some same disease. So we can also doctors sometimes may have too close in the environment. Maybe some patients can give some out of box thinking to the doctor or to the care provider.
Right. Yeah, Dr. Chen.
Actually, I don't think. Not yet. Yes. Yeah, testing.
Wait a few seconds. Okay.
Testing. Personally, I don't see a big difference in the culture that impacts the patient's behavior, seeking behavior. But I found it the education level or maybe the individual's attitude toward their health sometimes make a difference. Quite a lot of patient or laymen, they turn the responsibility of healthcare maintenance to the doctor, to the hospital. And some, they actually take that as their own responsibility. I think this attitude make a big difference in their health and also in their disease-seeking behavior. I think that is probably one issue that for us to improve. I mean, we should take the health in our own hands, not the doctors. Yes, right. I think Club has shared with you. Yeah, the modern healthcare system is actually a sickness care system.
Right.
Actually, doctors are not being, encouraged to maintain the people's health.
Yeah,
actually, doctors are encouraged when their patients are getting sick.
Yeah.
So this is the kind of attitude the public should embrace on. Our health is in our own hands, not in the doctor's hand.
Right. So basically, when we seek healthcare, that's when we just want a cure and to solve the problem right away.
Yes.
But in terms of maintaining or preventing, it's not really playing a very big role. So I think that leads to another thing that I wrote down about the quantified self as a concept, because we have watches. I don't have that, so I have a wound up watch, Fitbit and kind of Apple Watch Health, those things. So are those technologies helping us to kind of take more responsibility, as Dr. Chan has said?
I think definitely it will help. There are many wearable devices now. Actually, I'm actually trying one device myself, the CGM. I think Clube has just shown the continuous glucose monitoring device is one that helps patients with diabetes to monitor their blood sugar. I think this kind of self-monitoring device definitely helps those patients that are more, they will encourage them to be more motivated to take care of their own lifestyle, the eating style, that kind of things.
Yeah, but I think that it's a mainly health device, personal monitoring, but the data, how to interoperable with the health record is a big issue.
Yeah, right. So the transferability, do you think there should be standardization, not just locally, but the world over, because people move between countries very often these days? How do we address that problem?
I think that we need a quite innovative model, business model, as Dr. Chao said that, because I think this is not a technology issue. This is a business issue.
Right.
Because each vendors, they protect their data. Actually,
yes, right.
You ask Apple or Google to share data to each other, it's impossible. Yeah. So I think that maybe university or HKDI or Tsinghua make some pilot. They're quite useful for this area. Yeah.
So we're talking about data structure that can be shared. Whereas the visualization can be another layer that you add, I suppose. So things like HTML, but for for health data. That's interesting. Yeah. And maybe we should also talk about the idea of technology, the relationship between technology and human beings. I think we're increasingly aware that screen-based technology has its limitations. I think in the past year or so, we've experienced that a lot. What can we do in terms of reconciling the shortcomings of technology and the needs for human emotions and touch and things like that? Do you have any ideas about what would be the trend or what you would like to research into in the near future in terms of that? Yeah. Maybe Dr. Zhao?
I think the trends of the design, the shift from the form follows function to the design follows the emotion. So as the experts today mentioned, technology is a very important role, played a very important role to drive the innovation, but design can develop the solutions to help the people use the technology friendly. So from the healthcare perspective, I think when we talk about healthcare, is traditionally the healthcare talk about the evidence-based method, but now so they change to the narrative-based patient and doctor interaction. I think during this kind of changing process, I think design should play a very important role to develop the product and the service for the hospitals and the healthcare system. Yes, so I think it can make the big contribution for that.
agree that I think that Dr. Chao is very good about the narrative base. And also I think that how we can make the design to the technology, especially enable more human factor in the machine or in the AI is very important. Because you know that many AI now is quite not human. The feeling is not human. I think that because of all the programmers is quite just programmer, but not much designer. But you have many human design or many other discipline design, include the design of the algorithm and the interface, something like that. It's better for human to more interacting with the machine.
How about Dr. Chen? We before we started, we talked about remote diagnosis or consultation. Is there anything there that we can do?
I think in this coming post-pandemic era, telemedicine will be having a higher importance in real life. Because now patients are afraid to go out. They're afraid to see even their primary care physician, or even they have suspicious symptoms. They are not that ready to go to the hospital as before. I've just heard from today that there's some breast cancer surgeons, they're seeing breast cancer patients, they're coming quite late, most likely related to their avoidance of going out. So I think telemedicine, like teleconsultation or visual consultation with doctors or some AI or apps may have an important role in the future to, cope with this current crisis.
And I think that more sensors, more diversified sensors to monitor health and measure the health is very important. So I think that many like Tsinghua or Hong Kong UST or Hong Kong U can also to design or develop more different sensors, more human sensors to facilitate the telemedicine, I think.
Right, okay, great. Maybe we'll open up for questions to the floor. Any questions or comments about what our guests have presented? Anybody? Or online, do we have any? Not yet, okay. Yeah, another thing is, I think to follow on from the idea of the quantified self, I think I just want to ask another question is about behavioral change. Because we're talking about being able to monitor the stats of yourself, is one way to motivate, but maybe it's not enough to motivate. Is there anything else that we can do to change behavior?
Okay, I think that as I said that the innovation of the model is quite important. Besides the awareness of making the person to manage their health, I think that in the trend of the innovation technology, I think that how to make the data as your assets of your own is very important. You know that many people is not aware that, I contribute our data, but they don't know their benefits. The awareness of their own health is only their responsibility. But give and take, they don't know how to take anything from them. So how we can design a new model to enable them, you can contribute your data and any visible get back from them. I think this is, I have no answer for that, but I think we can think together of this.
Yeah, it's something that we need to look into, I guess. Dr. Chan?
Yeah, I think now in the general public, people still don't have the understanding that their own data, even their healthcare record, is actually part of their assets. It's actually very important for their doctors to monitor, take care of their health. I think we should, again, it's education, making the public getting more involved or be proactive in taking care of their own health.
Professor Zhao?
All right. So I haven't about that, but I just want to give the example for our project, which is we develop a new device to integrate the traditional Chinese traditional medicine diagnosis method with the modern Western the medicine technology, and then develop the wearable device for the aging population to monitor their health condition in their home and transfer the health data to the central hospital. I think that will be good for the aging society aging population to to get the high quality how can I say healthcare service.
Right. Yeah. And I think our discussion we talked about motivation, data, and things like that. I think the idea of visualization actually comes in at this point, isn't it?
Yeah.
I mean, how do you use visuals, the way you visualize the data, because you can represent the same data in many different ways. How do you use visuals, the visualization, to motivate? Or how do you, or even use visualization to simulate, a year down the road, you're going to be dead or something like that. I'm just kidding. But I mean, something like that to show possible scenarios, maybe. I don't know.
I think that in these few years, I always promote the concept of open API ecosystem, because you know that many health data, for example, the eHealth record system in Hong Kong, the government own the data, but they don't have a quite good API model to the industry. So when let the patients to visualize the benefit, it lead to more user case. For example, you have a 100 or 1,000 or 1 million health application. So to provide health data and some incentive, for example, to the real-time insights, second opinion from the doctors, I think it's very useful for the patients. But now it's impossible because of the data still keeping is closed from the government, the doctors, something like that. Yeah, it's the modern problem.
That's a very good point. The API and the idea of open data. Yes, I think that's going to give rise to a lot of opportunities to visualize the data in different ways, and comparisons and correlate and things like that. Okay, how are we doing for time, Tony?
Still have time? I don't know.
Okay, overrun咗咯。咁 let's finish here. And let's give a round of applause to our guests today. Yeah, thank you.
Thank you very much, Professor Chao.
Thank you.
Thank you all audience.
Thanks.
Thank you, Professor Chao. Thank you, Clube, Dr. Chen, Keith, and all of you who have, have been supporting the lecture series over the past few days. So please feel free to revisit the past 3 days of lectures on HKDI Facebook, as well as the HKDI channel on YouTube afterwards. Thank you very much. Have a wonderful evening.